All right, good afternoon, Facebook. This is Tommy Valentine. I'm the Executive Director of Historic Athens. I have the pleasure of being your host for episode 12 today. This is episode 12 of This Moment in History, COVID-19 in Athens, Georgia. If you're joining us for the first time, just to give you some background, over these 55 episodes, it is our hope that we will be able to introduce you to a cross section of some of the community leaders and professionals that define our community. In addition, this will give us a chance to explore and document a really unique moment in our city's history and county's history. Obviously, coronavirus has had a tremendous effect in the way that we communicate, the way we do business, the way we take care of one another. And so today is going to be no exception to that. We're thrilled to have someone who's on the front lines of COVID-19, and we'll be introducing him in just a moment. But before we get to that, I just want to emphasize that if you're tuning in for the first time, this is an interactive broadcast. And what that means is, as much as today is about the conversation that we'll be having live with Dr. Cullen Timmons of St. Mary's Emergency Room, it's also an opportunity for you to participate in history. So if you comment below this video, as long as we're still live, we should be able to share that comment or that question on screen with Dr. Timmons, and we should be able to address that feedback, that encouragement, that question, whatever it is that comes to mind for you. When we culminate these interviews, which we'll be doing every weekday at 1 o'clock until Friday, June 26th, when we do finish up, this entire broadcast series will be archived and contributed to our local research institutions and libraries. So you'll hear our conversation today skew towards two audiences. One is you, the person who's tuning in today, possibly participating in through questions or comments. But the other, it may be researchers or audiences 50, 60, maybe even 100 years from now that are seeking to look back at this moment and determine how Athens navigated such a treacherous and difficult time. So with that said, I want to go ahead and bring Dr. Timmons on the line with us. So if you'll bear with us, we'll replace the photo of Dr. Timmons with the real thing.
Hey, how's it going, Tommy?
I'm doing very well. How are you doing?
I'm good. Thank you for having me.
Oh, thank you so much for taking time. I know that for all ER doctors, time is a precious thing as it is right now. I can only imagine, and that's what we'll get into. Dr. Timmons, just to begin, I'd love to have our audience get to know you better and the work that you do better. But you and I were talking about before we went on air. You work at St. Mary's Emergency Room, which for myself growing up was kind of it's a very comfortable place. My mom worked at St. Mary's ER for 30 years and just retired this year. And I know that it's a phenomenal place full of really incredible people. We're thrilled to have one of them on the broadcast. But can you tell us a little bit about yourself and about what it's like working at St. Mary's Emergency Room?
Yeah, sure, absolutely. We miss Debbie a lot. She worked there for 30 something years on the weekends, so it's good to see her every now and then when she drops by. But yeah, I mean, St. Mary's actually has kind of a special place in my heart. I was actually born there 30 something years ago, and never went back until I interviewed for a job there after residency. But it is a special place. We're a little bit less busy than Athens Regional. We're a little bit smaller, and as a result, I think that everyone is maybe a little bit less stressed out. Obviously, the emergency room's a kind of a stressful place for anyone, practitioners, physicians, nurses, techs, patients. But I feel like the fact that we're a little bit slower means that you get a little bit more one-on-one time with your physicians, with your nurses, and I really like that a lot. It's still a Catholic hospital. There's still prayers in the morning and in the evening. We don't really have the nuns walking around and seeing people anymore, but you still do get a flavor of that, which is nice as well. I grew up Catholic here in Athens too, so used to go to daily church with my mom there. So I've got a kind of a strong bond with St. Mary's, and I grew up in Athens as well, and lived here until I went to medical school. So it's great to be back. I've only been back for a couple of years now, but I love it, and I'm happy that they have me there.
Very good. Well, that's a great introduction. And, Historic Athens celebrates historic places. St. Mary's is certainly a historic place. It's fascinating to think that you're working as a professional at the place where you were born. My wife and I, we have one daughter. She was born at St. Mary's too. And we went out of our way to make sure she would be born at St. Mary's because that's a place that's near and dear to our heart. I emphasized at the top of the program that folks can drop questions or comments below just to preview what that looks like, including some humorous comments that we'll bring on screen. But this is a great place if you have questions as the broadcast continues for some of the topics, more serious topics we'll be talking about. But Heidi Amelia said, my two favorite people. Thank you, Heidi. Kevin Jones said, the men, the myths, the legend. I don't think I can live up to that. We both are wearing white shirts, though. So that's one thing we have in common. And then speaking of shirts, Kirk Carter said Cullen couldn't put on a collared shirt for this. So
I don't own too many collared shirts, unfortunately. So sorry, Kirk.
All right. Well, we're sorry to let Kirk down on this one, but that's okay. Yeah, it's a global pandemic. We're not judging how anyone's getting dressed these days. I put on a collared shirt exactly for this broadcast, and then that's that. So, all right. So, Cullen, I want to go back more into this. So, like a lot of jobs, I think the average lay person understands being an ER doctor through media, through television, through movies, through what like these kind of exploitative depictions of what it's like working in an ER. If somebody's tuning in who's never known someone who works in that type of environment, can you break down what it's like just to work in an emergency room?
Sure, I can try. It's like we mentioned before, it can be a stressful place. I really enjoy the exciting aspect of it, where you never know what's going to walk through the door. I think that's one of the reasons I went into emergency medicine. Is it kind of keeps you on your toes, and it keeps things interesting. So it's very much different from other aspects of medicine, such as surgery, or a lot of folks that work in the clinic who get used to a certain type of patient, a certain procedure, and they become kind of experts on that one procedure. In the emergency room, we're kind of ER docs are more sort of jacks of all trade, masters of none, where we know a little. We have to know a little bit about everything, whether it's delivering babies on the fly, which fortunately doesn't happen very often, or setting bones, or managing traumas, or surgical patients. But really, what we are masters of, and what we go to residency for, is the dying patients, the patients that need attention immediately, whether they're in cardiac arrest, whether they're having a heart attack or a stroke. That's what we train for, and that's what we're specialists in. So emergency medicine's only been around for about 40 years or so. Really kind of came out of media, actually. So the show Emergency, which most people probably don't remember, back in the 60s and 70s, was kind of the birthplace of EMS in this country. And shortly thereafter, we created a specialty of emergency medicine and a residency in emergency medicine. And now it's kind of one of the biggest fields in medicine. So we've had board specialization since the early 90s. And it's kind of only a growing field. And part of that is the difficulty in accessing primary care in this country. A lot of people use the emergency room as kind of their primary care office. And in times like this, we're seeing much less of that than we usually do. But we're seeing very sick people coming in these days, and kind of less of the usual day-to-day grind that we see
Right.
sort of most days before a pandemic.
Dr. Timmons, if I don't remember, please remind me. I want to go back to that idea that folks are staying away from the ER right now and how that might be a good or bad thing in
Sure.
just a moment. But I'll bring this viewer comment up because I think it leads to a good question as well. Jess Brown said, I just want to say that Cullen is the best doctor I know. This guy spends his free time reading and studying and is constantly working to be the best doctor he can be. He's awesome and the best person to talk to. So thanks, Jess. Jess, I'm going to take
Thanks,
your
Jeff.
comment and flip it into a question here. So, Cullen, I think one thing that might surprise folks, and you've already alluded to it, is the degree to which how many hats you have to wear as an ER professional. And it's not like you walk in on your first day knowing everything you'll need to know for the rest of your career. There's kind of a continuous process of learning. Can you walk through that? I mean, so Jess here has talked about how you're constantly reading and studying. How does education play into your role as an ER professional?
Yeah, I mean it's a long road to get where we're at right now. So after college, you do medical school for 4 years, and then an emergency residency is 3 years after medical school. So after college, you'll have done at least 7 years. Some people do fellowships after that, and actually, emergency medicine is one of the shorter residencies. So most other doctors that you encounter will have actually done even more training, perhaps. And it is one of the reasons I chose the field is because you do have to kind of maintain such a vast knowledge, and you're constantly learning, constantly seeing new things. I trying to think of an example. Yeah, a few days ago, I had a patient involved in a car crash, and there was something wrong with his eye. I couldn't really tell what it was. I thought he maybe had a contact in or something, and I stained his eye and took a closer look, and it looks like it was probably the canvas from the airbag had left an indentation in his eye, which looking through the literature, there had only been maybe 1 or 2 case reports of that previously. So you're just by the nature of human interaction, there's always new things coming in, and you kind of never know. And unfortunately, that does make the job kind of difficult and tedious sometimes because we oftentimes don't get a lot of answers to what brings people in. What we try to do is we try to make sure that that there's nothing serious going on, that there's nothing life-threatening going on, and if we can eliminate that, usually we can get people back on their way, back home, have them follow up with their regular doctor, ideally, but just make sure that there's nothing serious. And so that's really kind of the crux of the specialty.
Well, before we turn to COVID, which we'll do just after this next question, I want to ask a question about kind of the psychology of being an ER professional. Growing up, one of the things that always blew my mind was that my mom, as an ER nurse working at your hospital, would go to an ER, which is one of the craziest places imaginable, and then would be able to come home and have dinner with us like a regular person. And the story that comes to mind is I remember in high school, my brothers and I, as high school age people tend to be, got a little arrogant and assumed we had heard everything there was to hear, and that there was nothing else that could shock us, kind of like you were just talking about with the canvas on the eye. And so obviously she was always very careful about what stories she could and couldn't tell for privacy reasons. But I said, well, I think we've heard all of this. And she teased us. She said, have you ever heard of what being degloved is? And I'd never heard of being degloved. And I'm not going to share it with the viewers right now, but if you want to look it up, just don't do an image search on it. But but it was just this idea that the body can be injured in so many ways that one wouldn't even consider. And so my question for you is, it's a two-parter. A, what draws someone like you to do this work in the first place, knowing that you're going to be going through that kind of dramatic change all the time? So what draws you to it? And then B, how do you sustain yourself? I mean, if you're seeing shocking things each day, do you eventually just become toughened to it and you just are used to it, or do you still find yourself having the capacity to be shocked?
It's a good question. I can't remember your first one. I'll start with the second one and come
Yeah.
back. But I think it's one nice aspect of emergency medicine is it's pretty easy to kind of live sort of two separate lives, and we don't take call, which for folks that don't know, everyone talks about doctors and call, but that's basically when you're going home and you have the potential to be called in at any point and go back to the hospital to see a patient. That doesn't happen in emergency medicine. We just staff the emergency room 24/7. And so when you're off, you're off. So I think that aspect, probably more than any other job, when I'm off work, I don't have to think about work at all, which is another kind of reason that I chose emergency medicine. Is you can take long vacations, and sort of really, divorce yourself from work when you need to. That kind of keeps you sane and grounded, I think. Sorry, and so the first question was
what draws you to something like this type of environment?
Yeah, I mean, I think most people in emergency medicine have a little bit of adrenaline, somewhat of adrenaline junkies. I think we tend to try to work under pressure, thrive under pressure to some extent. And I think if you kind of shirk from the pressure, then it's probably not the best field for you. But for most people, once you've trained as long as we have, you tend to do well under pressure, and you've seen enough things where it kind of becomes sort of second nature.
Absolutely. All right, one last comment, and then we'll go to getting in more serious territory here with COVID. So Nate Miller dropped in to say, not all superheroes wear capes or shirts, ties, possibly pants. So
Nate's one of the emergency medicine. He's also now a physician up at Vanderbilt, and we did residency together up there. He's a bit of a joker, but
well, listen, I mean, as long as you have enough scrubs, why would you need to own anything else?
That's another aspect of why I chose emergency medicine. Yeah, I can't tell you the last time I wore a tie. So
yeah, well, that's one upside. So all right, so Dr. Timmons, transitioning here now that we've gotten to know you and your work a bit better. So every field imaginable has been impacted by COVID-19. But I cannot imagine a field that has been more impacted than yours. For starters, I'd love for you to unpack the chronology of it. When did this really start coming onto your radar? When did it start affecting the work that you were doing? How did those changes unfold?
Yeah, I'm not, I think like everyone else, time's kind of running together for me as well. So it's sort of hard to remember exactly dates, but I do remember getting an email from the CDC. I believe it's from the CDC, may have been from the World Health Organization, back in January, speaking about this novel coronavirus that they had isolated in a place I'd never heard of, which of course we all know is Wuhan, China now. And I remember reading the email and just kind of filing away, not thinking anything more of it. And then sort of gradually with everyone else, as various media outlets began to kind of report on what was going on there, we started to hit our radar a little bit. Again, I don't think we were thinking very much that it would be a pandemic. I think we were thinking more it'd be kind of like if SARS-CoV-1 was back in the early 2000s, where only something, in the order of 100 or 200 people died, as far as I can remember. But it became, once we started to see it spread to Iran, other countries in Asia, we sort of knew what we were in for. I think that we were, by kind of mid-February, we were starting to sound the alarm here. I work with a bunch of amazing ER docs. I'm sort of one of the junior members right now in our group, but we have especially one gentleman who's done a fellowship in infectious disease as well. and he was really sounding the alarm. And it was tough to get people to listen initially. I think that we knew that we were certainly susceptible to a pandemic, and I think physicians were around the country kind of the first people to sort of realize what we could be in for. And unfortunately, it took everyone else a little bit longer to sort of jump on board with that. We initially had some trouble, kind of even with our administration within our hospital, and I think that was sort of nationwide. It's just sort of hard to realize what this was going to become. Fortunately, they became very responsive after sounding the alarm for a week or two, and sort of nationwide, it's been kind of the same thing. I think one aspect that was really nice was here in Athens, we had a very responsive group of for Mayor Gertz as well as the commission shut down Athens earlier than anyone else in the state, and we've certainly reaped the rewards of that. I think we have the lowest per capita infections of anyone in the state as far as any towns and cities go. And it's nice to see the leadership, especially from Russell Edwards, who first sounded the alarm, and he reached out extensively to our group of physicians, as well as I'm sure to Athens Regional, and got us to try to jump on board and shutting Athens down. It's been a dramatic effect nationwide on emergency rooms, probably nowhere more than in New York, where they've seen just an astounding number of really sick patients. This isn't a virus that's like anything we've seen before. It's really not related to flu, as far as we can tell, very, very much. The way it affects the body is very different. And we are trying to understand the physiology, but it's difficult. We're just seeing a lot of things that we haven't seen before. Fortunately, here in Athens, we've been somewhat insulated, somewhat protected. I think the last count I saw was maybe somewhere around 150 cases or so in Athens. So we certainly aren't on the front lines like they are in New York. But it's been really interesting to try to learn from our colleagues in real time what to do. And, we don't have time to do as many trials as we ordinarily would like to do in medicine. So we're really just getting kind of the day-to-day reports from a lot of physicians up there as far as what's working and what's not. And it's changing day by day. It's really hard to keep up with everything, because initially what guidelines, are sort of mandated one day, it turns out to be probably the wrong practice later on. We learned a lot from Italy as well, in the critical care community in Italy. And we've sort of adapted a lot of the lessons from there. And as a result, I think that the U.S. has done a fairly good job at keeping the death rate low compared to some countries like Italy and Iran. And really that probably is mostly a testament to A, what we learned from them, and B, that we do have a very advanced critical care capacity in this country as far as our ICUs are concerned. So as long as our ICUs aren't getting overwhelmed, we can save a whole lot of lives there that otherwise wouldn't be.
So I want to ask a question here. So the role of information in the public has been so important. You talked about how Commissioner Edwards, Mayor Gertz, the other commissioners worked to act quickly locally. As an ER doctor, you're meeting people every day that have all kinds of that watch different media, that get information from different sources. We've seen a glut of conspiracy theories and fringe suggestions, different recommended treatments. How has that affected your work, the way the public has come around on this thing?
Yeah, I fortunately haven't seen too many people injecting bleach or anything like that yet. Hopefully, I hope not to. I am very offended by people that kind of poo-poo science and are um, less believing in what we do. I mean, we don't really have any ulterior motives. We got
Mhm.
into medicine to help people, and we use science to do that. And science really is, it is what it is because it's a disprovable area. We study things and we can tell you, this works, this doesn't work, and if we're wrong, we go back and we study and we study and we study until we get it right. So this is a very frustrating time for everyone because we don't have information that we need, and it's going to take a long time to get the information. And
Yeah.
as a result, I think everyone is kind of reaching um, for some sort of a cure, which we just don't have right now. Um, I think all of us are putting our hopes in a vaccine within the next 12 to 18 months is kind of the number that we keep shooting for. And until then, I'm not sure that we're going to find a magic bullet to help. Certainly, social distancing has been a phenomenal way of slowing this down.
Yeah.
And, that really has probably been our only win so far, I would say. The studies on hydroxychloroquine or Plaquenil are kind of all over the place. So we don't really know if that's going to be an effective treatment yet. We should have more data in the next couple of weeks on that. There's another very expensive drug called remdesivir, which is showing promise. But again, it's very expensive and we don't know for sure that it's working either. So for now, it's just basically best practices in the ICU and what we call supportive care, which
Yeah.
is just kind of treating people as things start to collapse. And that's what we, with all of the knowledge that we have, we don't have a magic cure. So we really try to encourage people not to go out on their own, listening to
Yeah.
conspiracy theories online, and doing things that isn't recommended by your doctor, because right now we don't have any good medicines for this, and certainly other than social distancing, I don't think there are any other good practices that people can do on their own other than washing their hands. Um, I think using a mask is a really good idea that we were advocating for even before the CDC kind of started making it mandatory. But I think that certainly should be helpful as well.
Along the lines of what you were just sharing. So in the last week, I've seen a video pop up that has spread very quickly among otherwise very reasonable people. Uh, I don't know if you've had the chance to see it. It's two urgent care doctors from, I think, Bakersfield, California. The lead doctor, I think, is Dr. Erickson. And these are two doctors who own urgent care. I don't fully understand the doctor process. My understanding is that they are not doctors who have passed their boards. They are doctors that own urgent care. But in the video, they appear wearing scrubs, using a lot of medical terminology, seeming extremely reputable, and effectively seek to debunk sheltering in place, debunk a lot of these good practices, speak in terms that almost advocate for this idea of like herd immunity type stuff, say that by sheltering in place, we're destroying our immune systems. And because they present themselves as doctors and because they are speaking calmly and sagely, the video is really taken off. And I recently shared this on my Facebook. I've seen a second wave of it go around today, but last night or yesterday, the American College of Emergency Physicians and the American Academy of Emergency Medicine, because they had presented themselves as ER doctors, denounced the video and said that the doctors doing the video were doing so to increase their financial gain. That basically they run a COVID testing center out there and they run these urgent cares, and that this seemed to be financially beneficial to them. My question to you is, A, with so much information swirling around, for well-intentioned people out there, how do they know what information to trust? If someone pops up on their feed, how do they know whether they should trust it or not? And maybe from a doctor's perspective, so A, how they know what information to trust, and B, why should we trust this idea of sheltering in place? Can you explain that?
Yeah, well, I can try. um,
Yeah.
I've seen links to that video. I haven't actually watched it. I've
Mm.
actually in the last I've gotten so frustrated by all of the back and forth on Facebook. I've actually taken Facebook off my phone. No offense that we're on Facebook right now, but
Yeah.
it's just been a very kind of tedious time to be on and sort of seeing all the misinformation and all the bickering back and forth. Um, I think that a lot of well-intentioned people can disagree on exactly what the best motive is, or I'm sorry, not the best motive, but the best practice as far as opening up our country as soon as possible. Um, I don't think we know for sure. I think that all of our models, the CDC, the National Institutes of Health, the World Health Organization have advocated for, seem to show that this is the best approach, and it's only effective if kind of everyone's on board. Sweden very publicly and to kind of a lot of fanfare has gone with a different approach where they've sort of tried to get herd immunity as quickly as possible and let people who are otherwise healthy get out on the streets and go about their daily lives. And they seem to be having some success, although certainly they have a higher death rate and infections toll than the rest of their neighbors. So, I don't know is the right answer. I don't know what people, what sources people should go to believe. The CDC has not been the clearest source of information from the start on this. They've kind of gone back and forth on a lot of their advice. Initially, the Surgeon General told people not at all to wear masks, and now he's telling everyone to wear masks. So I can see why people are going to different sources and looking for information everywhere, and we physicians are doing the same. We don't have a whole lot of clear answers. All we can say is kind of this is what we think is the best practice right now, and that's changing on a day-to-day basis as we get more and more information. I think that the best source of information is your local Department of Public Health. The CDC is the best source of information as well for the country. But like I said, this is such a new area for us that guidelines are going to be changing on a day-to-day basis, and it's hard for me to fault politicians wanting to open things as quickly as they can. I really need a haircut, as you can probably see. There's a lot of aspects that we want to open as well. And when you're in a place that's been as fortunate as Athens to have as few cases as possible and not have our ICUs overrun as they are in New York, it becomes very tempting to want to reopen things. So I don't know if I answered your question effectively. I kind of
No, but so I guess what I'd ask you to complete there at the end, though, is that so you have this empathy for folks that want to reopen as soon as possible. If you're in the need of an emergency haircut, I can teach you how to shave your head if you need to. I'll do a live cast for everyone out there who needs a coronavirus chrome.
Oh gosh,
Yeah. But certainly, it seems like, I mean, you're on the front lines. You're in danger every day on this. I know that we keep hearing stories about emergency professionals that are having to make personal sacrifices about self-quarantining away from their family. I would imagine you want this over as quickly as possible, as much as anyone. But it also sounds like you're saying at this time there is no better treatment on the horizon immediately than to shelter in place. Is that right?
Yeah, I think that's right. I think that's the safest approach for everyone. if you do have to go out in public to do something essential, I would wear a face mask. I would frequently wash your hands, uh, and I think that's the best approach right now. I don't know. The problem is the psychological toll that this is taking on everyone.
Yeah.
I don't know how long that's sustainable for. It's certainly not going to be sustainable until we have a vaccine, because I think that's likely not going to be until next summer.
Right.
And I can imagine people doing this for that long. So I don't know what the answer is. For now, I'd say we stick to guidelines and try to minimize your interaction with as many people as possible. But
Sure.
at the same time, your mental health is important as well. We're seeing a huge uptick in suicides. We're seeing an uptick in domestic violence, and all of that is it's kind of a balancing act. How do you we're very social creatures, and how do you allow for that, and still try to keep your social distance? I've had so many Zoom calls with friends and family, which has been super helpful. But I can certainly commiserate with people that don't want to follow these guidelines. We just ask you to do it as long as you can, and if you need if you need psychiatric help or psychological help, we're here for you as well in this time.
Great. A few things here. So we've got about 15 to 20 minutes left in today's broadcast. I want to just pop up. Deborah Gonzalez said, today is National Superheroes Day. So thank you, Dr. Timmons. So I look forward to Dr. Timmons being added to the Marvel Cinematic Universe in the next installment. But in all
I'll be
seriousness,
sure to be drinking Tropicalia there too. So
there we go. There we go. That's right. You and Thor. But in all
yeah,
seriousness, we hope you know how much Athens values the work you're doing. And it's no small thing to say superheroes. David Hill said, first university, first to smell the fires in the Okefenokee. David Hill, I don't know what you mean, but if you want to add some additional comment there to give us the context, that'd be great. At this time, we're just going to very briefly thank our annual sponsors, but don't go away. This is only going to take about 60 seconds, and then we're going to bring Dr. Timmons back on the screen to ask some further questions. Very briefly, I just want to say that we want to thank our annual sponsors. These are the annual sponsors you see on screen here. We are so grateful for the folks that help us sustain our work year round. For those of you that don't know, Historic Athens is a 52-year-old nonprofit. We operate out of the old fire hall on Prince Avenue, right over by the Wendy's. And we also operate the Athens Welcome Center, as well as Hands on Athens, that does charitable home repair for low to moderate income individuals in historic homes. A lot of our work is education and advocacy oriented, public programming. We do historic preservation work. If you think that local history is important, if you think it's important to understand and preserve our history, please consider becoming a donor, sponsor, or member. You can find out how to do that at historicathens.com. I promise you, as someone who looks at the budget every day, we need every dollar possible to keep this organization going, especially in times like these and for times like these. You can become a donor member for as little as $5 a month, and that really matters. It helps us keep our lights on, our team employed, and our work like this completed. So please consider visiting historicathens.com and becoming a new member. We'd really appreciate it. And thanks again to all of the sponsors you see here. I will point out that each week of our broadcast is brought to you by a different sponsor. This week is brought to you by the Office of Mayor Kelly Gertz. We really appreciate Mayor Gertz's leadership at this time. We also appreciate the financial support that allowed us to do this broadcast this week. So thank you very much to our sponsors. So jumping back to our conversation here with Dr. Timmons of St. Mary's. So I mentioned earlier there was something I wanted to go back to. So you mentioned that as emergency care has evolved, for some people, it's replaced the idea of a primary care physician. Some people depend on you for basic care. And at the same time, because of shelter in place and general fear about COVID, you've mentioned you've seen a drop in that type of care, where the folks that are coming, someone who might have otherwise come to see you is now not coming to see you.
correct.
Is that concerning for you? Are you worried that there are people out there that are kicking a health can down the road that they shouldn't be?
Certainly, we are worried about that. There's been a lot of innovation in the healthcare field in the last couple of months. There's been a big uptick in telemedicine and people trying to see their doctors virtually. We, you know, even from a financial standpoint, we're taking a pretty big hit in the emergency room, which is surprising to most folks. But we rely on billing patients, and if there aren't any patients, we've had some trouble. So we've seen a decline of about 50% in our
Wow.
patient pool, which is nice to some extent because it seems to say that folks are healthy, but I doubt that's the case. I think people are just scared to come to the emergency room. It is a safe place, I can tell you. I mean, we're doing a very good job at keeping everything clean. If there's anybody suspected of coronavirus, after they leave the room, we do a UV light in the room for about 30 minutes to kind of kill any virus that could be in the room lingering. And if you think you need to come to the emergency room, of course you can call ahead and ask us a question, but we really aren't allowed to give any advice, any medical advice over the phone. But we're open for business, and certainly if you feel like you need to see us, we are there. So, I think that a lot of people are worried about the uptick in kind of people not treating their stable medical conditions during this time, and what that could look like down the line. But hopefully everyone's staying safe out there.
Great. I'm going to bring up one more comment here from Kirk Carter. Again, if you have questions or comments while we go into the last quarter of our broadcast here, feel free to share them. Kirk just said, just want to note for posterity that no one is better suited to his profession than Dr. Timmons, man blessed with tremendous empathy and selflessness. Athens is tremendously lucky to have him back. So strong vote of confidence.
Kirk's a good in high school and college and after college, and an attorney down in Florida who I think may be returning back to the area here soon. So it'll be good to have him back.
One of the best parts about Athens is you can't really leave Athens. It eventually pulls you back. So, Cullen, I want to go through, there's 3 questions we tend to throw out in the last quarter of our interviews. I want to start with the first one here. So if right now, because of shelter in place and because of restrictions, because of business closures, although there are a lot of great small businesses you can shop curbside, there are some of our favorite restaurants aren't open. Some of our favorite bars are closed. We can't go see some of the concerts we would have liked to see. If tomorrow shelter in place was no more and everything opened back up tomorrow and you happened to somehow have the day off, what would be some of your first stops? What are things you miss doing?
Well, so I live in 5 Points right now, and so I tend to not leave 5 Points very often. And from my back porch, I look out over the Royal Peasant and just kind of yearn for the days of sitting out on the porch of the Royal Peasant, especially because the weather has been so magnificent this entire month. I feel like we've lost a beautiful Athens April. So I would love to be there. But you're right, a lot of businesses are open. So I've been eating a lot of Cullen Timmons, a lot of Frolic as well. The expat has been doing these meals that you can prepare at home, which I've done several of, and trying to support Normal Bar and Bain Maddox's ventures over there. So, but I think the Royal Peasant would probably be my first stop when we can get back out to a bar.
Absolutely. Yeah, I do want to mention for those of you that are tuning in, Bain Maddox and Normal Bar is doing we actually took advantage of this last night. You can buy the cocktail mixer there for like $10 a quart and just bring your own liquor and get it done that way. Cullen Timmons, we've done pickup there. There's so many places that are doing great pickup. Expat, the folks over there who support us are doing really great work. Lindsay Brannon of the Chamber of Commerce just jumped in to say Normal Bar turns 10 today. I know they had a big, awesome. They had a big thing planned. So hopefully we still get to see that celebration. But yeah, as you mentioned Tlaylock. Let's record this for history. When this moment came, they literally sawed into the side of their wall and made a drive-through in their restaurant. So we see a lot of innovation out there. I think there's two things that have popped up here that I want to share on screen in addition to Lindsay's comment. Gary Birch, great community member. That's the train that goes behind my house. Gary Birch, Gary and Jones supported the first week of this program. Gary just shared, this has been an interesting and beneficial conversation. Thank you, Dr. Timmons and Tommy, for all you both do. Clearly, you contribute to a better community and world. So thank you again, Dr. Timmons, for what you're doing. And Gary, thanks for tuning in and sharing that with us.
Thanks, Gary.
Alex Sams, who tuned in, wanted to ask this question. Are elective surgeries happening now at St. Mary's? Have you seen any change in that?
I spoke last week with one of our surgeons, and my understanding was that they were supposed to start back up this week. I have not seen much change. I don't know if that's going on. I'm assuming that it is to some extent. If you have a question, I would just speak with your surgeons, and they should certainly know the answer. My understanding, though, is that to a limited capacity, I think we have opened up elective procedures. I may be wrong. I don't really work on the inpatient side. I only see folks that come to the ER, so I'm not necessarily the best informed on that. But my understanding is I believe that there are elective procedures starting to happen again.
Absolutely. Well, if it wasn't for the haircut thing, I guess that'd be good news. I can go and get that hair transplant that I've been holding out for. Okay. I want to go to our last two questions here. And the last question is going to be very open-ended. You can take as much time with it as you want. But our second to last question here. So first of all, you mentioned that Royal Peasant is right outside your window. So you're in the Styles Apartments, is that right?
I am.
Okay, great. So that's one of our favorite historic places. We gave them our organization gave them an award. That's why they've got that banner at one of our preservation awards. So if you're watching this and you want to nominate for this year's Historic Preservation Awards, you can do so at historicathens.com. But okay, so you live in a historic place. St. Mary's is a historic place. Part of our job is to preserve historic places. One of the concerns coming out of a recession or a dramatic moment in time like this is it can rapidly endanger historic places. People get kind of a change for change's sake mentality, and suddenly the bulldozers come out. And so one of the questions we've been asking each of our 55 guests is, if someone is viewing this video 50, 60, 100 years from now, what are some historic places in Athens that you love that you hope that they are still able to go visit? Is there any place that comes to mind that you just really love here in Athens?
That's a great question. I mean, I grew up in Cobham, in kind of a 1912 craftsman house. So I'm very attuned to the historic nature and the historic neighborhoods here in Athens. I'm actually trying to close on a house this week, just a block from the Athens, from the old fire hall. So hopefully I'm moving back to the neighborhood. Yeah. So Cobham is my favorite place, probably in the world. So I think the houses there are certainly incredible. Finney Spalding, who I think may have been one of the initial founders of the foundation.
That's right. Yeah.
Kind of was sort of the godfather of putting historic preservation back on the map here in Athens. And, going from, you hear all these stories of back in the 40s and 50s of Prince Avenue just being lined with mansions, kind of like Madison, Georgia is, that looked like the Taylor Grady house and the president's house and whatnot, and just all being torn down to put up, I love Popeyes like the rest of you, but to put up Popeyes and Crystal and just sort of restaurants up and down Prince Avenue, which is really unfortunate. But I think that what you guys have done and what the Greater Athens community has done as far as really trying to preserve these homes has been phenomenal. certainly I wish that the downtown weren't changing as much as it was with all of the sky rises and everything. But as far as the homes here in Athens, I mean, I think they're just incredible. Whether it's in Five Points or Cobham or Boulevard, all up and down Millage. I think I go on pretty much daily runs and try to find a new house every day. I really love the homes here.
Well, well said. And we love, you serve our community well, but any ER doctor that can pull out the name Finney Spalding's doing pretty well. We actually, at last year, our 50th Preservation Awards, we gave away a biennial Finney Spalding Award. So to Linda Davis for her community impact. Linda runs the Brooklyn Cemetery, but yeah, it's.
I actually knew Finney, so I lived 2 doors down from him. He passed away when I was probably 4 or 5, but he used to pick me up by my ears, and that's kind of one of my memories of him. And my mom is still best friends with Margie, and love the Spaldings for sure.
Yeah, we do too. Well, that's great. Well, that's excellent. Well, we love knowing that overlaps well for you. A few quick things to pop up before our last question. Nancy Lee Nix shared elective surgeries are happening again as of yesterday. Kirk Carter wants to put it out that speaking of running, who is faster between the two of us? So I'll let you guys sort that out.
Can't remember.
I'm going to just assume it's Kirk if he's asking that. And then Missy Brant Wilson, when we were talking about Styles Apartments, said hi neighbor. And although it's exciting that we'll get to feel like we get to say hi neighbor soon, if you move back towards Cobham, you can stop by the fire hall. And then Alex Sams, speaking of the Styles overlap, said my mom lives in the Styles Apartments and has mentioned, and Alex, I can't do a good Southern accent, so I'm not going to try, but says there's a nice young ER doctor that lives here, said in a Southern voice. So so clearly you're making a good impression. My last question for you, Dr. Timmons, is, as we mentioned, today has been a lot about getting the right information out, helping just explore this moment and all the competing information sources, understanding what an ER doctor does and what your ER is going through. But we do think there's a good opportunity that sometime from now, 50, 60 years from now, someone may be looking back, seeking to understand this moment in Athens. What would you say to that person? What should they know to understand this moment?
I mean, I think that none of us thought that this moment would be possible. I think it's amazing how quickly things can change on a dime. One moment you're going through life and the stock market's doing great and everything's groovy and you're getting ready for the Masters and G-Day and whatnot, and all the great things that spring in Athens brings. And then the next moment, everything is shut down. And it's amazing what we can kind of do as a society when we all come together in times like this. I think I'm in my early 30s, so sort of the only moment that I can think of that is even remotely similar would be 9/11, and sort of the communal aspect that came out of that initially for the first few months afterwards. But this has been something that none of us were prepared for, quite obviously, and the amount of change that has been wrought in just the last couple of months, and the amount of investment from everybody in society to try to keep those most vulnerable in our community safe has been amazing. The ingenuity of the businesses has been amazing, and I'm just really, really proud of this community and all that it's done to try to combat this virus and to completely selflessly go away from your normal day-to-day life for the benefit of everyone. It's going to be a hard recovery for sure. We were talking about some of the small businesses that have been shuttered. It's going to be really tough for them, and I just encourage everyone keep supporting your local businesses as much as possible, keep supporting the nonprofits as much as possible. Obviously, come back to the ER at some point. We miss you, but it's just been an unbelievable time that we never would have thought was possible. And if anything has taught us, you can always learn from history. This is certainly something that we tried to do, and we didn't necessarily do a great job. But this happened almost exactly 100 years ago with the Spanish flu, and
Right.
it will happen again. And it's just all about coming together as a community to keep everyone safe.
Absolutely. We have a few things squeaking under the wire here. You've got an offer for a beverage. Kevin Jones says he'll be happy to buy the doctor a drink at Royal when we get to hang out again. Thanks for
Fortunately, he's 21 now, so that's good.
That's true. It's good to know we have Kevin in common. Kevin was a phenomenal intern with us. Big fan of the McChicken, Kevin Jones. And then Aaron Lacey dropped in to say, great discussion, Dr. Timmons. Yeah. And so I guess I have one last question after all, just something you said. When we have business owners on here, for example, when we had Janet Geddes, who runs Avid Bookshop right underneath you, it's easy to say, how can we support you? When we have a restaurant owner, it's easy to say, how can we support you? Because there's usually some pretty well-defined ways we can show our support. I know that we're seeing a lot of folks express their thanks online for our healthcare professionals. I know that there's been a lot of talk of the likelihood that the Time Person of the Year might be these frontline individuals like yourself that are working there for us. But for those of us in Athens, Georgia, how can we show our support or our gratitude? What's the best way for us to support the work you're doing at the ER?
Yeah, I mean, everyone's been truly, truly great. I think when this first started, people were bringing food. A lot of businesses were giving us food, which is awesome. And someone put out a sign in front of the ER and stuff like that. People have been really appreciative, and that's great. I mean, honestly, the best thing you can do is just to keep following. We're in the health business. We don't do this out of a desire for money or fame or anything like this. We do this because we care about your health. That's the reason I came back to Athens, is because I love this community, and I want to do what I can to keep everyone as healthy as possible. So just keep practicing good practices. Wear a mask in public. Wash your hands frequently. Stay 6 feet away from people. It's really tempting to try and have parties and whatnot at your house, but just resist that temptation as long as you can, and just keep following the guidelines that are put out there. That we don't necessarily. We'd love your financial support, but we'll survive this. We just need you guys to survive and get through to the other side. So stay healthy.
Very good. Well, Dr. Timmons, on behalf of Historic Athens, thanks not only for making time to talk to us, but also for the work you're doing. It is a great comfort to know that if I or a member of my family or anyone involved in Historic Athens gets sick, that St. Mary's is out there, that Piedmont's out there, that we have such great local hospitals and healthcare workers like yourself. So thank you again for all that you do.
Well,
thanks for our audience.
For your time, and say hello to your mother for me.
I will. I will make sure that's right. Yeah. I will make sure to say hi to my mom. And she actually told me last night when I said you were coming on the program to make sure I said hi to you. So hi right back from Nurse Valentine. Yeah. So, all right. We're going to go off air here. I encourage all of you that watch this to tune in again tomorrow at 1:00 for our next installment. We'll be doing these every 1:00 every weekday until June 26th. So thank you very much. Thank you, Dr. Timmons. Thanks. And please stay safe and healthy out there. We'll see you tomorrow at 1:00. All right.
Thanks, Tom.
Bye.